has approximately 1,600 cases at the moment, and I think the numbers are increasing of the order of 70 to 90 per day. So the doubling time in Morocco is actually quite long, and in that sense, Morocco has the opportunity to keep it that way. There have been 76 deaths, unfortunately. So mortality is reasonably low. The epidemic curve is relatively flat, but that can change at any time. We've seen this in country after country. Countries go along with a small number of cases, and then it reaches a certain point and that curve takes off. So it's really important, and many countries in the Eastern Mediterranean and North Africa have done a good job in doing that. But it does require to have extensive testing and broaden testing out, actively looking for cases, and dealing with all of the other strategic issues that other countries do. But in principle, Morocco is in a strong place to continue control measures, and also be in a strong place to be able to lift any restrictive measures, as long as Maria has said that that's done gradually, as long as that's done with great care, and as long as the other public health and community measures are in place. But I'm sorry, I don't have a detailed set of data for Morocco in my head, but if my memory serves me, that is where Morocco is epidemiologically at the moment.
Thank you very much. Hope this answers the question from Morocco. Next question is from Devex, from Sarah Jerving.
Thank you. I'm wondering what is the appropriate time frame for someone to isolate if they think they might have been exposed? There seems to be this belief that 14 days is appropriate, but since the incubation period can be up to 14 days, so then if someone is not showing symptoms after 14 days but does have the virus and doesn't have access to a test, how long after that can a person have the illness and be contagious? And then in terms of the reactivation in people, based on your previous response, is it possible for the virus to be latent in someone, or are we talking about reinfection?
Thank you for these questions. So yes, what we recommend for somebody who is exposed to an infected person is that they be followed, that they be quarantined for 14 days. Most people who are infected with COVID-19 will develop symptoms within 5 days. That's the median time, 5 to 6 days. But it goes up to 14 days. So 14 days is a good marker. For individuals who are infected, your question was how long can they be contagious? And that's the right question, because when we actually test people who are infected with COVID-19, they have this molecular test, a PCR test, and they can be PCR positive for weeks. But that doesn't actually mean that they're contagious for weeks. So what the PCR does is it measures fragments of the virus, parts of DNA of the COVID-19 virus that is detectable through this molecular test. But it doesn't actually mean that you're contagious for that long. What we've seen from some preliminary studies, and I'm referring to a study from Germany, is among some mild patients, I believe it was 8 or 9 mild patients, that they could find live virus for 8 or 9 days after symptom onset. What we need is much more data from countries to actually be able to say how long is someone contagious. And so right now what we have are these PCR tests which suggest that people with mild disease can be PCR positive for 2 to 3 weeks. What we need to understand is out 2 to 3 weeks, are those people still contagious? And so again, this is another example where we don't have the full picture, but there's a lot of studies that are underway to give us those answers. And so we hope to be able to get back to you with more details on that as soon as they're available.
On the issue of reactivation and latent infection, I mean, there are many situations, particularly in viral infection, where someone doesn't clear the virus entirely their system. It can happen in the case of immunocompromised people who are sick for other reasons, and then the virus can come back and attack the person again, and that's sort of seen as reactivation. It's not that it's usually that the virus was never properly cleared. There are other situations where someone clears the virus but develops a secondary infection, a secondary bacterial infection. Often in influenza, for example, it's not the influenza infection that causes the problem. It's very often the secondary bacterial pneumonia. The damage to the lungs and the inflammation creates, unfortunately, an opportunity for bacteria that are normally non-pathogenic, they're all over the place, but can actually exploit the fact that the lungs are weakened. And you end up then with a very high fever again and very sick, but you're actually not sick with the virus, now you're sick with the bacterial infection. So there are many reasons why we might see reactivation of infection, either with the same infection or with another infectious agent. The issue of long-term, I think, transmission has been dealt with by Maria. There will always in health be exceptions. There will always be individuals who may transmit for longer. There may be individuals whose incubation period may be for longer. It may happen. There are outliers in every walk of life. We all know people who are given a year to live because of a cancer diagnosis and they live for 10 years. That doesn't mean that everyone with that diagnosis lived for 10 years. It means one person has lived for very much longer, but on average, this is how long people survive. And I think we need to look at that. These are averages, and then we look at the range around the average, and we try to explain that this is likely where the longest or the shortest incubation periods are in reality. But there will always be a chance of an outlier. And I always say we need to study the outliers. We need to study those who transmit for longer. We need to study those who have don't clear the infection properly, because these are very significant events. But we also have to be able to make good public health policy, and we have to try and make the best possible estimates of what is a reasonable incubation period that incorporates the vast majority of people, and reasonable transmission periods that incorporate the vast majority of people, and at the same time look at outliers, examine them, why they're occurring. And that is the work of science, and in the end, you've got to translate science into policy. You've got to translate all of that data into a rational policy that can be implemented for public good.
Our policy actually is. It may be helpful. And this is based on the science that we have. So what the WHO recommendations are is for someone who tests positive for COVID-19 with a PCR test, what we recommend is to be released from either hospital or from home isolation is that their symptoms resolve and they have 2 negative PCR tests 24 hours apart. Now, we realize that that may be difficult in many situations where lab testing may be challenged for one reason or another. So in situations where tests are not available, if you have someone that's home that's a suspect case, that's a probable case and couldn't get tested, what we recommend right now is that those individuals are in home isolation if they can't be isolated in a medical facility until their symptoms resolve, plus an additional 14 days. Now, what we're trying to do right now is look at that 14-day extra period to see if that's something that can be reduced based on available data.
Thank you very much. We have time for maybe another 1 or 2 questions. So let's go to Guatemala now, to Grecia Ortiz from Diario La Hora. Grecia, can you hear us?
Yes. This is a question for